One of the things I love about healthcare is how diverse it is and how much I'm reminded every day of what I don't know. I love learning and I love finding out about new technologies and new aspects of healthcare, and that's what drew me to this conference. When Illumia reached out and said, hey, we like to come down and cover their user conference, my immediate answer is, well, of course, I love user conferences. But more importantly, when I started to dig into what the company does and what part of healthcare they play in, I was fascinated. You see, Illumia, formerly known as CBORD and Transact, they play in the area of food service, supply chain, retail management for healthcare. Everything from managing patient meals to managing the retail cafeteria and the retail outlets at a healthcare system. I wanted to find out how they're helping healthcare, and I came down and really enjoyed my 3 days here, and I can't wait to share with you some of the things I found out. Let's get to it. Now, full disclosure, Illumia did invite us to come down to check out their user conference. And while we were here, we did agree to do some videos with them. However, they have no input into this particular one and have no idea what I'm about to say. So, like I said off the top, I did not know a lot about this area of healthcare other than, of course, partaking in eating at the various cafeterias and retail outlets over the years in healthcare systems. And I have to be honest, I did not realize how complex and how involved and how many moving parts there are to delivering a proper meal to a patient's room and to delivering a meal to staff and to loved ones who might be using the retail cafeteria. Just think of all of the allergies and all of the food requirements, the dietary requirements, the nutritional requirements that have to go into making someone's meal. And then, of course, there's just all the logistics of managing a restaurant at scale. And then, of course, something I found out here, nurses only have 30 minutes for their lunch breaks and are expected in those 30 minutes to get their food, eat it, and then get back to work. They do not have time to stand in a long line at the cafeteria. So a lot of what the company does here is all around making that experience much more swift. I'm talking about online ordering to pick up. I'm talking about kiosks. I'm talking about self-serve checkouts. And I'm talking about really fast, efficient order entry. But I think the biggest surprise for me was the amount of money that can be saved from food waste. Just by having a single platform, you can get visibility into your supply chain, you can reduce the number of SKUs, you can manage your suppliers better, and of course, what that means is more efficient use of your resources. And hey, that's something we're all after right now in healthcare. Now, while I was here, I did have the chance to catch up with a couple of Illumia's healthcare clients, and I had the chance to ask them how they're using and leveraging the technology to improve both patient experience and staff experience. First up is Jenna Sampson, and she is from UC Health. Here's a snippet of my conversation with Jenna.
So we worked with clinical informaticists to image all of the nurses' iPhones with the CBORD patient app for ease of access. So the nurse can go into the patient room, ask them, they would present a menu and ask the patient what they would like so they can input their order right then and there in the room. They also really enjoy using the web version of the CBORD patient to be able, if they have a lot of different orders from patients, they can input multiple orders at one time and queue them for that selected delivery time.
So right then, when the nurse is in the room with the patient, they can just go on the app or go on the website and order through the CBORD system.
Yes, exactly.
And then that goes to the kitchen, and then they prepare the meals.
Exactly.
Okay.
Yep.
And I understand you have quite a number of requirements for these meals. You have like safety meals, as you were explaining, with special utensils and special containers and things. And you also have just a whole bunch of dietary requirements. How does that work in the system?
Oh, it's awesome. So for any patient that is on a safety tray, again, that was per our risk assessment to determine what items could be sent and those that need to be left off of patient meal trays. So safety tray is just programmed into CBORD in the way of what's compliant or non-compliant. I built new recipes to make sure that that modification was presented on the meal ticket. And then if a patient has a nutrient restriction or allergy, again, only items that are compliant will be presented through the patient app menu.
Tony Boggs is a senior director at Corewell, and Corewell is an amalgam of 3 healthcare systems. What he talked to me about was the complexity of moving from 3 separate systems onto a single instance of Illumia and the difference it's made for their organization. And here's a short clip from that conversation.
We definitely had a lot of different systems across our many departments at Corewell Health. And then in my department, Nutrition Services, we had 3 different instances of our CBORD platform. Separate databases, separate people working in there, the contents of those databases were different, so we had a lot going on when we had that merger. But if you look at like Corewell Health, our newly formed healthcare organization, there's some untapped potential that we had. We can use our size, our complexity, we can align our products to be able to negotiate for better pricing. And being able to do that actually helps the healthcare organization achieve its goals. So we started looking at different technology systems that could help us operate as one, where we could actually build that foundation for success. And we landed on what was CBORD, now Illumia, net menu product. And that allows us to have that foundation where we can store all of our diets, all of our recipes, our products. We do our ordering through there. And it allowed us to basically build our department how we wanted it to look for the future. Our system actually went to 1 instance of Epic. So that was kind of a key milestone that actually happened, I guess you could say. A milestone that allowed us to really embark because we didn't want to connect 3 instances of our nutrition technology to Epic. So we needed 1 instance. So that was 1 criteria, something that would connect to Epic. 2, we needed something that we could manage at a high level. I mean, having 24 hospitals across the state, I don't want to change a chicken breast product, 24 different times. I wanted to change it once. So we needed something simple to manage, and we needed functionalities that would help us with patient quality.
I did have a chance, and I was very impressed with the executives that I met here, and they really spoke to me at length about some of the exciting new features and some of the things they've been doing in healthcare to really get the word out there, because to be honest, and they've self-admitted this, they need to do a better job telling the fantastic story of their healthcare customers and their healthcare work, because it really does make a difference for staff and patient experience. And one aspect of their solution that I really didn't think about was the patient safety aspect of that. So I had a chance to sit down with Arun and Eric from Illumia to talk about their system. And here is a snippet of that conversation.
Yeah, it was interesting. I mean, 67% of our folks were just signaling, hey, we're having major challenges keeping prices updated across our ecosystem. And that impacts the patient menu, that impacts the retail menu. And when you're running the business, not being able to quickly, efficiently update your pricing across all endpoints, that's a real operational challenge. It's an operational risk. In an operational challenge in today's environment. So that was really, and all the other survey questions in terms of menu updates, in terms of getting a new vendor supply chain, it was almost 50% where clients are struggling. So it's a real, that's what I was saying, a transformational opportunity for us to really connect these platforms and deliver more value to our clients. It'll help them.
Yeah, actually very agreement with Eric on that. The other thing that we did was we also asked them a question at the end is, what is most important to you? Right, kind of what we talked earlier about. What's most important to them is patient safety and guest safety or employee safety. And the answer was about 63% was about that. Eric touched a little bit on the labor optimization or the labor cost piece of it, which is about 54% is what the response. So when you take the disconnected system and being able to update something as basic as a menu item with what is really important to them, you kind of look at it and go, well, we need to connect these systems to help them solve for it, right? So it was really easy for us to sort of find that answer when we sort of looked at both of these things side by side.
Now, for those of you that know me, you know I can't resist a good exhibit hall. And while I was here, I was on the hunt for companies, partners of Illumia that do work in the healthcare space, and I found a few. First up is a company called Alcatraz. Yes, very cool name. They make a solution that provides access to physical locations through card scan as well as facial recognition. Here is Jason Byrne talking about their solution.
Good morning, my name is Jason Bryan. I'm with Alcatraz. We are an organization that helps to protect our universities and healthcare facilities. A lot of facilities we are speaking with rely on things like cards, which can be shared with other individuals. Here at Alcatraz, we leverage the power of a biometric, specifically your face, to where we can better protect these areas with face and card. In healthcare facilities, there's a lot of use cases where we see this technology deployed, specifically server rooms or patient record rooms, where we want to make sure only authorized people are gaining access into these spaces. We also protect a lot of doctors' lounges and admin areas where maybe they want to get through their areas more quickly and not rely on a card, where they can just approach the door and their face allows them access. So behind me is the Alcatraz Rock X, which again, we're leveraging the power of your face for fast access into facilities. So I've previously enrolled, so as I approach the device, it authenticates my face and I'm allowed quick access. So that's the speed you can expect. We also protect for tailgating, and that's a common issue in healthcare facilities where maybe Jason, I walk up and I get authenticated. Our technology will help detect if other people are following into some of these maybe more sensitive areas. And to kind of double click on some other use cases, there are some other highly sensitive areas in hospitals like the radiology rooms or pharmacies where we, again, want to make sure we're protecting those with the best technology. That's what Alcatraz offers.
When I walked by this next company, I was fascinated by this, a reusable food-safe container that is rated up to 1,000 washes. Talk about reducing waste. The company's called Ozzi, and I had the chance to catch up with Jessica Cantone, and she's going to share what this is.
I'm Jess Cantone. I'm here with Ozzi Reuse. We do a full solution of reusable containers and collection systems. So essentially helping hospitals, senior living centers, healthcare facilities switch from a single-use option to a reusable one. So we have everything from reusable containers to the collection systems to ensure that you're getting those containers back. We have a full line of cups, clamshells, soup containers, all that can be collected by our Ozzi machine, which I have behind me. And I'll do a little demo to show you how it works. Essentially, the diner is going to take their food to go, whether that's an employee or a resident in the community. And once they're done with that meal, whether it's after a meeting or after dinner, even the next day, they return to the Ozzi collection machine and deposit the dirty container. From there, if they have an integrated program with Illumia, they can use an ID to return their container, and this is what's going to credit back their account. So this is their proof, their validation of return. The machine itself is collecting that container into a secure bin, which gets returned to the dish room and washed with everything else that's being washed, your flatware, your cups, mugs, things like that. So it's a seamless process for diners who are looking for a really nice user experience. It's not difficult. And like I said, we already work with senior living centers that are really excited about the sustainability side of doing something good for the environment, but also on the food management and operator side who are looking to save money, save the environment, and purchase less containers over time. So yeah, that's what we're all about.
Now, it absolutely warmed my heart to see a company here in the exhibit hall that is 100% dedicated to the healthcare space, and that is Curbell Medical. And they make a device, a bedside device, which replaces the traditional call bell. It has entertainment on it. It of course allows people to order meals, and it even has the ability to connect with MyChart from Epic. To tell me more about it, I stopped in and met with Art Caprio, and he's going to give me a quick tour.
All right, I'm Art Caprio. I'm a senior product manager for Curbell Medical. This one is called Rego. So for 60, 70 years we've made this device, and it's gone through various iterations over the years, adding certain features, but it's still basically an antiquated technology that's limited by some of the equipment that we plug into.
Right.
So we divorced ourselves of those limitations, tried to get more with the times, and graduated into a tablet version of the traditional pill speaker, which incorporates all the traditional pill speaker functions in addition to an Android tablet that allows you to network into the hospital networks and use apps and control your environment in a more enhanced manner. One of the strong value propositions, people pay a lot of money, or hospitals pay a lot of money to have Epic in their hospitals, and one of the initiatives of those Epic teams is to bring that to Bedside and have more people use it, have access to medical records, patient education, etc. So right on the tablet, the MyChart app will allow you full access to those features. Yeah, through Epic, they have ties into meal ordering system, patient education software, etc. For those that don't have Epic, you can get standalone applications for those type of meal ordering softwares.
Now, one thing I have to say about the team at Curbell Medical, they are the only folks who I know who are on the same travel schedule as I am. They were at the previous conference, they're at this conference, and up next is HIMSS, where we're going to see them again. 3 weeks, 3 conferences. All the power to them, and kudos for putting up with that level of travel. So overall, I have to say, I'm very impressed with Illumia. It has been fantastic to be down here to learn so much about this aspect of healthcare. This is a typical user conference. They treated their users very well, great food, great venue, lots of fun things for the users to do. And really, a lot of the customers I managed to speak with, they're very excited for some of the new developments, especially around AI, but also just their, the cloud-based systems, the order entry system, something called Quick Charge, which is a new acquisition of theirs, a relatively new acquisition of theirs, that does all of the stuff online for people and does mobile entry and POS and those kinds of things. Very cool technologies. And again, my eyes were just opened into how complex this world really is and how much of a difference it can really make for the patient experience and patient safety. I can't wait to catch up with Illumia again at future conferences, and hopefully we'll be back next year to cover it more in depth. If you made it this far in the video, we would really appreciate it if you could mash that like button and click subscribe. Also, head over to healthcareitttoday.com where you can find more great content like this. I'm Colin Hung here at Illumia's User Group Conference. Thanks for watching, and I'll catch you on the next video.